Basic psychology. The psychodynamic approach. The role of the unconscious.
According to Freud, the unconscious mind controls most of our everyday behaviors. Do you know how he came up with this theory?
Yes, he used an iceberg as a metaphor to describe the different layers of the mind. The tip of the iceberg above the water represents the conscious mind that we are aware of. Slightly below this is the preconscious, which stores information capable of becoming conscious but is not done so without us thinking about it. The bottom and biggest layer represents the unconscious mind, which is inaccessible yet, according to Freud, controls most of our everyday behaviors.
That's interesting. How does the unconscious mind reveal itself?
The unconscious mind reveals itself in slips of the tongue, during creative moments, or even neurotic symptoms. Freud believed the unconscious mind controlled both our waking and sleeping minds, and its role was to actively suppress and prevent traumatic memories from reaching our conscious awareness through the use of defense mechanisms.
Wow, I had no idea the unconscious mind played such a significant role in our lives.
Yes, it's a critical part of our psyche that we need to understand better.
The structure of personality.
Freud divided personality into three components: the ID, ego, and superego. The ID is the instinctual basis of personality and operates only in the unconscious mind. It drives an individual's biological needs and operates on the pleasure principle.
That's interesting. What about the ego and superego?
The ego represents the rational component of personality, which mediates between the demands of the ID, the external world, and the superego. It operates on the reality principle and forms the planning part of personality. The superego develops from the age of 4 and is divided into the conscience and ego ideal. It operates on the morality principle as children internalize societal moral codes on right or wrong while also producing feelings of guilt for bad behavior.
So, a healthy adult would have a strong ego that can mediate between the ID and superego?
Yes, that's right. Freud believed that an individual with the ID in charge would be pleasure-seeking with little concern for morality, while an individual with the superego in control would be guilt-ridden by even socially acceptable pleasures.
That's a really interesting theory. It's amazing how much our minds can influence our behavior. Defense mechanisms.
Yes. Repression involves unconsciously pushing and blocking difficult thoughts out of the conscious mind.
I know. Freud proposed 3 defense mechanisms: repression, denial, and displacement.
Repression involves unconsciously pushing and blocking difficult thoughts out of the conscious mind. Denial is when an individual refuses to accept the reality of situations as a way to deal with worrying or unpleasant information. Displacement involves the redirection of feelings towards a less threatening target than where they originated from.
That's informative. Can you give me an example of each mechanism?
Sure. For example, someone who is abused by parents when young may not recall this due to repression but may struggle to form relationships in adult life due to this early abuse. Denial can be seen when an alcoholic denies they have a drink problem despite it causing them problems. Displacement can involve someone taking out their frustrations towards family members when the original cause of the feelings may be from somewhere else.
I see. That's interesting. How do these mechanisms work?
Freud believed these operated unconsciously and worked by distorting the perception of reality to stop the individual becoming aware of unpleasant thoughts or feelings which may damage the ego.
Psychosexual stages.
Psychosexual stages is a theory by Freud that explains personality development through 5 stages.
Interesting. Can you explain each stage in detail?
Sure. The first stage is the oral stage, which lasts from birth to 18 months. Infants obtain pleasure through feeding, sucking, and biting through the use of the mouth. The anal stage occurs between 18 months to 3 years, with the child's focus being on the expulsion of feces and bodily waste. The phallic stage occurs from 3 to 6 years, with the child's focus moving to the genitals and self-exploration. The latent stage occurs from 6 to 12 years, with conflicts from the previous stages being repressed. The genital stage spans through puberty and adult life, with the focus shifting from pleasure gratification to secondary process thinking and gratification through intimate relationships and adult responsibilities.
That's fascinating. What is the significance of these stages in personality development?
According to Freud, unresolved conflicts from these stages can lead to personality disorders and fixations. For example, if a child experiences unresolved issues during the anal stage, such as harsh toilet training, they may develop an anal retentive personality. This personality type is characterized by excessive cleanliness and orderliness.
The psychodynamic approach evaluation.
The psychodynamic approach includes and explains the importance of how childhood experiences may affect later development in people. This approach also incorporates the role of the subconscious and feelings in driving certain behaviors in people.
That's interesting. What else does the psychodynamic approach provide?
The approach also highlights the importance of a child's upbringing and strengthens the case for reforms, providing real-world applications for us to apply, particularly around children's rights. It suggested new methodological ways for psychologists to gather evidence based on case studies and observable evidence rather than subjective introspection.
That's impressive. Are there any scientific supports for the psychodynamic approach?
Yes, Fisher and Greenberg, 1996, concluded after examining over 2,500 studies that psychoanalysis compared well with other psychological studies, and there appeared to be support for unconscious motivations in behavior as well as the existence of defense mechanisms such as repression, denial, and displacement. It also provided alternative explanations for disorders such as depression and anxiety, adding credit to psychological causes rather than necessarily biological.
What are the weaknesses of the psychodynamic approach?
One of the major weaknesses of Freud's psychodynamic approach is that his ideas are very difficult to test reliably. Other psychologists, therefore, argue his ideas are unscientific and cannot be proven, as trying to test whether a methodology has reached the unconscious mind is difficult. It is also gender biased, as his views on female sexuality were much less developed than his male views. Evidence for the approach comes from case studies which lack reliability and population validity due to the lack of generalization. The case studies for which Freud founded this approach on were also based on people from Western backgrounds, and it could be argued that this approach is culturally biased and may not apply to people of different cultures.
I see. Is there anything else we should know about the psychodynamic approach?
A major strength of psychoanalysis is the comprehensive nature of the theory to explain aspects of human behavior outside the realm of psychology. Psychoanalysis can be used to question and understand the meaning of people's behavior through analyzing people's work. For example, literature such as Hamlet has been analyzed to find repressed messages within the text to try and understand Shakespeare's own psyche.
That's fascinating. So, what are the criticisms of using psychoanalysis like this and with patients?
A major criticism is that interpretations will be subjective to the practitioner's own interpretation of what the patient tells them. Some could argue that analyzing patients would tell you more about the practitioner than the patient themselves, which would make this approach less valid.